I think we'll start with this evening's program. Thank you so much for joining us for this talk with Dr. Sunil Chandy. My name is Karun. Uh, just before we start, we'd like to thank you once again for the ways in which you covered us as a family in prayer. Really saw us through a very difficult season these last few weeks. Joe, my wife, and I were down first towards the start of April. We were in Kotanur shortly after Appa and Amma got it in Promised Land. Kavya and Cyril got it shortly after that. We didn't have any contact with each other for a good month and a half, but we still all managed to get from somewhere. And really grateful for your prayers and the ways in which you helped see us through that very difficult situation with Kavya being in the ITU and the miraculous way in which she had a complete turnaround and was discharged within a week. And just like to thank you all for being here this evening. And as we start, just like to begin with a quick word of prayer before we get on with the program. Father, we thank you for each person who's joined us this evening. We pray that the session is a blessing, that we're able to learn something new, ask questions, grow as a community together, as a body. Thank you for each person joined in here. We pray protection, blessing over them and their families. We ask you to be in control through this next 1 hour that we spend together. In your name we pray, amen. All right, just so we can get started, I'd like to introduce our speaker for this evening. First and foremost, to me, he is Sunil uncle, but I will do this introduction that we have of him. I know him to be my uncle. He's always been there. He's always been around, always there to help whenever we need it. And I know he's an extremely busy person, which is why I was surprised when I heard that he was going to be doing this talk. We're very grateful to have you here with us. Dr. Sunil is the former director of Christian Medical College in Vellore. He's currently the medical director of the ITC Healthcare Project. He is a cardiologist by training. He's been on the faculty of CMC Vellore after his studentship and post-graduation there. He is an alumnus of CMC Vellore. He joined his MBBS in '78, went on to complete his DM in cardiology in '94. And thereafter, he joined as faculty of CMC Vellore. He briefly worked in small hospitals in Bihar and Kerala, which influenced his choice of his medical career. He was inducted into administration in CMC after his MPhil in hospital management, and after being deputy medical superintendent and vice principal, he was appointed director, a position he held till recently. Although a tertiary care specialist, Dr. Sunil has always been passionate about a whole person approach in health. Background, financial ability, occupation, and family realities are extremely important for him in his practice of high-tech health delivery. His area of interest has been developing a compassionate and humane basis for organizational development in healthcare. Traveling and speaking widely on health and management topics, he has been invited to national and international conferences as a resource person. He's also spent short stints in Adelaide, Muscat, Brunei in different leadership roles. He's currently the medical director of ITC India, helping them convert their vision in healthcare into a reality. Some of his talks are on YouTube, his writings are on LinkedIn. We're all excited to hear from him. These next 40 minutes, we'll open it up for questions after that. So over to you, Sunil.
Thank you, Karun, for those warm words. Welcome. I want to wish everyone in the glorious network a good evening. The talk is about understanding COVID from ground realities and understanding this disease that has got such a devastating appearance be seen from inside. 18 months ago, there were few words that were not part of anyone's vocabulary, at least the common man. One of them is COVID. It is a new word which has been put together in the context of this pandemic. There are also words like quarantine and lockdown, N95, remdesivir, which almost everybody has heard of, and some people have used it as well. So this is the reality of the current situation, where we are facing new situations that are challenging us on a day-to-day basis. Some people have written articles saying that this is the word that is relevant today, that it is in some ways an apocalypse. A strange word, difficult to pronounce. Most people have only heard of it but don't know what it is. It is a worldwide event that could result in an existential crisis. And in fictional writing and in novels, the apocalypse is something that happens when a large meteorite strikes the surface of the earth, or it might be a nuclear disaster induced by warring countries. It might be the climate change that we are talking about, where the recession of the Arctic ice and the flooding of the earth might annihilate the human race. Or it might be yet again a pandemic like we face now. There have been pandemics in the past that have challenged the existence of human beings in history. It was not exactly like the COVID pandemic, but those of us who believe in the Bible know that the world was completely wiped out during Noah's time and God spared just that one family. There was also this very similar experience that people had in the land of Egypt when there was a wave of death that moved across households, and the only way they were vaccinated by was by the blood of the lamb being posted on the door. It was a wave, nobody could see what it was, and today's COVID experience is also like that. Not a single person has seen the virus, but it has wreaked havoc in our world today. So what I'm going to do over the next 40 minutes or so is to unpack this for you in very simple terms. Let me put a disclaimer here that I'm not a virologist, I'm not a public health expert, nor an epidemiologist to speak with the full science on my side, but I will share with you what I have understood from a patient's perspective, because I am privileged to know and treat a lot of people with very simple forms of COVID over the phone and on the net. And I just want to share those experiences with you so that you feel reassured that we are dealing with something that is manageable if we manage it in the right way. So I'll talk to you about what is COVID, how does it spread, how do we prevent it, how do we test for it, how do we treat it, and what do we have now after the second wave, and with so much of talk, so much of writing, so much of discussion that has gone on. So this is what it is. You can see it on the screen, or I can show you a model of this. This is my granddaughter's toy, which looks like a COVID, so I just picked it up. A small little organism which is not visible to the naked eye, which has got these spiky projections, which has got a cup at the end, which used to attach itself to the host tissue. Let me show you a very short video on how all this happens. But before that, it is a virus of the corona family, which is well known to medical scientists. And this is the family of viruses that causes the seasonal flu, which we all have. Every year, we have a snuffle, a cough, and a cold, and we move on with life. The SARS and MERS epidemics, or near pandemics, that happened in the early part of this millennium were all due to viruses of the same corona family. But the COVID-19 is like a spoiled child of that family, a spoiled flu virus, which has taken on a little bit of a sinister appearance or a sinister behavior, and attacking people who are vulnerable. Not all of them, a few of them who are vulnerable get the attack in a very severe form, and they go through a course which is quite frightening. The truth is that there is no specific treatment against the virus, despite all what you read on WhatsApp. No specific treatment against the virus. All that the medical world is doing is preventive and supportive treatment. And of course, a few agents that may alter the course of the disease if it is given at the right time.
The coronavirus lodges in the throat and enters these cells in our pharynx, as we call it medically, the throat, and it becomes a part of this cell. Now, this is something which most people do not understand.
So this is where it starts. You breathe in the virus, which comes in through the aerosol or the mist of the nasal secretion, which you may have breathed. It gets into your throat and it uses its spiky proteins to attach itself to the walls of your throat. And then it internalizes by a very clever mechanism, and it becomes part of the cell, where the genetic material, the yellow strands that you are seeing, will then cause the host cell to replicate the same virus very profusely, and the person is said to get infected. So that's where you start. The person gets infected, and then the virus multiplies in the cells and in the body fluids, including the discharge that comes through your nose and your throat. 80% of the people who get the infection have hardly any symptoms. They may have nothing, or they may have very mild symptoms like a common cold, which you tend to ignore because it mimics the seasonal flu. Those who get it will have sore throat, a fever, running nose, and a dry cough. There will be a sneeze and a cough, and in that process, the patient or the infected person will spray a mist of droplets into the air. And I'll show you a video. This is very easy to understand, and it puts a visual perspective on what really happens. It will also impress on us the basis of why doctors and nurses and the medical fraternity is insisting, almost like an obsession, about masks and social distancing. So someone breathes in the part of the mist, some unfortunate person, and he gets infected. So now you have another person infected, and the cycle will go on from person to person. So how does it spread? The current understanding is that it is airborne, and I put it in red because 95% of the spread is because of these microparticles that travel through the air, and that is why it covers such long distances. And it amazes us as to how it penetrates even closed rooms where your parents may be staying, and they claim that we have just not stepped out for the last 1 month, but we are COVID positive. So it is by droplets that come from the nose and mouth. It is not by contact as much, very minimally it may be through contact. And it starts, the full life cycle of the virus is about 14 days. The earliest one can get infected is 2 days from the time of exposure, but it could be as late as 12 days as well. You don't have to worry, it does not spread through injections or through any skin or any other contact. And definitely it does not spread through food as much as we can understand the behavior of the virus till now. Have a look at this video, and it shows you what really happens. This is a laser light photography of a person speaking and saying the words 1, 2, 3, 4 up to 10. So unknown to us, when we speak words like da and tha, we actually release a mist of air which may contain the virus into the immediate surrounding. And the same thing happens when we spit on the ground or on the road, and also during singing. This is what happens when you sneeze. The discharge is more pronounced and prolonged and profound. Have a look what happens when this is put against a laser light technology. So it travels almost 110 centimeters, 43 inches is the extent to which one gush will go into the air. Or when you cough, it is much more violent. It can go up to 26 feet. And that is why World Health Organization and other regulatory bodies are now rethinking on the 6 feet social distancing norm that was in existence till now. What happens when you speak, and this is a comparison when you have no mask versus one layer cloth mask or a double cloth mask, and in the right bottom end a surgical mask, just to impress on you why it's important to identify the right kind of mask to protect yourself and others. So this is when you speak. This is when you cough. To see the difference, just see your left upper quadrant and the right lower quadrant, and you will know the difference. This is what happens when you sneeze. Impressive, isn't it? So let me now go to the next stage. So what happens when somebody is infected? What are the symptoms that you will have? Now, first, it's important for us to remember that all the symptoms are above the neck. Nothing happens below normally. There are exceptions, and I'll mention that as I go along. So the symptoms are what? Low-grade fever. It is usually 99, 100, but occasionally it can be more than 100 as well. Most people will have a sore throat, which they may notice or they may not. There is a dry cough that happens in a significant number of people, which dry cough means a cough without any productive sputum. Usually there is body ache, and in some people it is as intense as what people have had during chikungunya. One symptom that stands out, which is very, very exclusive to COVID, is loss of smell and taste, which people have complained. That you suddenly stop smelling the common things like talcum or perfume or whatever. And you also lose your taste appreciation to the normal things that you may eat. In a few people, there will be breathing difficulty, and this is where mild disease turns moderate and moderate disease becomes severe. We'll talk about that as we go along. In a very few proportion of people, there has been headache. People have complained of tummy ache, and some people have complained of diarrhea as well. This is particularly true in the elderly age group, where they have a tummy upset which precipitates loose stools for a couple of days. Now, we've been talking about the first wave and the second wave, and now there's a lot of fear about the third wave. So what's the second wave? Second wave is second wave. It is the new wave that started in the month of March and has peaked towards the end of April or beginning of May, and hopefully it is on its way out. It is the wave of the same virus. It is the same virus that was responsible for the first wave. It's called SARS-CoV-2. And it has, the difference is that the second wave also has, along with the original strain, it has a mixture of what's called mutants. These are all variations in the genetic structure of the virus, which is called the UK strain, the Brazilian strain, the South African strain, and the double mutant strain. I will not call it the Indian strain because, people are watching. It is definitely more infective, as we have seen. The doubling time of the virus was 26 days in the first wave, but it has become much more rapid. It is now about 10 days. Within 10 days, the number of people infected have doubled, as we all have seen in the daily news that we watch at 9 p.m. It is definitely more virulent, which means it attacks more aggressively. It has somehow affected more young people compared to the first wave. There's been a very rapid progression. You're okay on day 1, day 2, you're all right, and day 3, you suddenly worsen, which pushes you into an ITU or an ICU. And of course, there are increased death rates, as we can see very painfully as we watch the television images. It's very devastating and heartbreaking to see the scenes that we are seeing in our country. I won't spend much time on this. This is just a picture of the various strains. Those who like to can just click on the net and understand it a little better. So this is the second wave, which is on the right side of your screen, and it tells you the approximate timeline. And this is where we are. The wave is actually coming down. If you put an aggregate of what's happening in the country, mercifully, thank God. But in our state and in your state, Tamil Nadu and Karnataka, it is still with very high numbers and high death rates. Hopefully, with the lockdown in effect, the numbers will start coming down in the next couple of days. So this is now what I'll do is to just put these questions which people have put to me, and I'm sure this will resonate with the same questions you have in mind. Over and above this, if there is time, we can go through some other questions. So the first question is, who's at risk of developing serious COVID disease? Today, it is the unvaccinated group. This was not there in the first wave, but today, since we have vaccines, and since there are a large number of people who refuse vaccines, they must know that if you don't get vaccinated, for whatever reason, because you are scared, because there's a hype against vaccine, if there is a vaccine hesitancy, that is not good for you. People with diabetes, heart disease, and cancer are more vulnerable. The elderly, which is people above the age of 70, just because of their age profile, they are more vulnerable. People who are on steroids for asthma or immunosuppress for other diseases have got a low immunity, and therefore they can catch the virus easily. Those who are physically debilitated by virtue of age or illness are also weaker. Pregnant women are vulnerable because of their special status, and certain other groups like that, which we can discuss as we go along. Older adults are more likely to get severely ill from COVID-19, and this is of course an aggregate number from first and the second waves. 80% of all deaths have occurred in people above the age of 65. This is including the European data and the American data. And more than 95% of the deaths have happened in people older than 45. So age is a very important factor which we must keep in mind. What are the high-risk scenarios? One is proximity to anybody who is COVID infected or COVID discharging, and you are speaking to the person, or he or she is speaking to you, or has inadvertently coughed into your field of activity, or has sneezed. Now, this is something very commonplace. We travel in buses and autos, stand in queues where someone sneezes or coughs. We wouldn't bother, but today it has become a risky event. Therefore, because of the impact of human density, being in a small room or living in a small room has become a high risk event. Similarly, it need not be in a small room, but if you have a large room with large gatherings and mass crowds, like in stadia, in conventions and religious gatherings, and in election rallies, as we have seen, the proof of the pudding is what we have seen in West Bengal and other places, large gatherings and mass crowds. Traveling in public transport is today not a good idea, because we don't know the profile of the person sitting on your left and right, and there is limited space to move. So what do we do in this pandemic? There are 4 P's: prevention, protection, prescription, and population measures. Prevention is what? Prevention is something that you and I need not bother, because it is the job of the scientists and the public health experts. It is to recognize the patterns, the graphs, and arrive at predictive solutions. They do mathematical modeling and say that, okay, a third wave is coming, a fourth wave is not coming, etc. It is to also avoid high-risk exposure in the situations that I described. One can scale up immunity at a herd level, at a population level. This is again the job of the scientists, and of course general measures, which we will talk about. The second P is protection. And now let me mention to you the principles, because you can always extrapolate those principles in your own life situations. One is the principle of barrier. Barriering is done by what? You put a barrier, you put something that obstructs the passage of your secretions to the outside, or somebody in the vicinity of yourself is prevented from his secretions reaching you. So masks, face shields, which are just plastic screens that are dropped from your forehead down, can be used. The second one is the principle of distancing, which means that whether you have a mask or not, it's a good idea to maintain a distance. Today, as the video showed, if you cough, your secretions or your aerosol, COVID-laden aerosol, can travel up to 40 feet. It's not possible to be at 40 feet from one another. That is not practical. But what you can do is to follow the general principles of quarantining. If somebody is suspected to be COVID positive, you isolate them in a room so that the others are protected from the infection. And of course, on a mass scale, what we are going through now, lockdown is not foolproof, and I'll explain why. Principle of defense is what is today getting vaccinated. There is no argument, there is no justification for not accepting vaccination today. Whatever be the taboo or the belief, vaccination is the only thing that can help you convert a possible serious illness into a mild illness for yourself. And of course, uh, by a stroke of fate or whatever you want to call it, if you get infected, that is like getting vaccinated, and you will be having the immunity that you need, at least for the near future. So this is just a pictorial that tells you why a lockdown has to be total. And that little curved arc actually shows you the concept of a total lockdown where all the viruses are below and nothing is allowed. There's no movement at all of people, and there's total lockdown. It will help. And actually, if you study what has happened in Delhi and Mumbai and other places where the numbers have dropped, it is because there was total lockdown. Does partial lockdown work? Before India had total lockdown, there was partial lockdown in some states, night curfew, and some groups are allowed, some activities are allowed. It's an absolute sham medically, because this is what happens. If you have a partial lockdown, those little gaps represent the compensations or the caveats that are allowed. And what happens is this, that at a particular point, the virus is clever enough to escape, and your outer leading edge becomes bigger and bigger. And as you can see, those gray maps, they will all start to join one another, and you will have a new leading edge, a new wavefront, with the virus playing havoc as it expands its territory. So this is mask. There's no need to give a lecture on mask. Everybody is masked, but you must remember that cloth masks are not effective as much as surgical woven fabric because of the nature of the way it is woven. Some people have initially used homemade handkerchiefs. I would say that handkerchiefs are always folded obliquely, so it is double layered. If you have nothing and you have a handkerchief, it's better to have a handkerchief across your nose and mouth than have nothing at all. The N95 masks, which are actually designed for a different purpose, but is also effective for COVID protection. You have seen some leaders of our country not wearing masks but have mufflers. They just wind around. Very ineffective. There is no scientific evidence that it helps, because there are gaps by the side of the nose. It keeps falling down. You have to readjust it, and therefore it is not considered equivalent to a mask. And of course, now the standard is double mask, which is two masks, one behind the other, one of which one has to be of the lower variety, the surgical mask. Social distancing of 6 feet is still standard, but there's already a regulatory change in that it may become 20 feet in the near future. Double masking is now a universal precaution, and minimum use of sanitizers. We don't have to be obsessive compulsive about wiping your hand every 2 minutes, and every time you touch something, then you use an alcohol rub. That was a recommendation in the first wave, but that's been given away. Do not get obsessed or compulsive about the use of sanitizers as long as you have soap and water. Avoid closed spaces, avoid crowding, and get into a huddle. This is not the way God intended us to be, but for the time being, we have to do that. And of course, in red, vaccination. There are 5 things to repeat. Stay at least 6 feet, social distancing. Tick on that. Double masking, as you can see in this picture, tick on that. Sanitizers as required, tick on that. Huddling, which is basically man's gregarious behavior, which is a natural thing, but it has to be proscribed now at this point in time. So not allowed. And of course, anything that involves a clutter of people is also not allowed. This is a small video that demonstrates the concept of social distancing. Sad, we are in a huddle for now, and this is what happens. The virus will knock you down. Watch it 2-3 times. Everybody goes down. And when you are socially distanced, this is what happens. There's actually a flaw here. It's not that by moving away, the virus is given space to go through. That's just a pictorial demonstration. It's just that you are away from one another, which makes it difficult for the virus to get transmitted. These are the milestones of COVID illness, and I think this is an important slide for those who are listening. Often asked, how long does it take? I don't remember to have met anyone who was infected. But that aside, whichever way you may have been exposed, it takes 2 days to 3 days for the virus you to get exposed to the virus and that to colonize your throat. Colonize your throat is colonize your throat. It basically means that it seeks residence in your throat, which is the back part of your nose and the back part of which is called the pharynx medically. From the time it gets colonized to getting infected, which means it is sucked into your body and you start to become a factory for the virus, it takes 2 to 5 days. And from the time you achieve that to the time that you make big symptoms, maybe 5 to 10 days. The disease persists. The lifestyle of the virus is about 2 weeks normally. Rarely it can stay up to 21 days. We've had patients who've had fever and distress and RT-PCR positive status for 21 days. There have been isolated case reports where RT-PCR has been positive almost 3 months after the infection. Not to worry, it is because the RT-PCR doesn't differentiate between a live virus and a dead virus. So remnants of the virus, the dead virus persisting in the body can give you a positive reaction. So all of us can be in one of these 4 situations, exposed to a person with infection, but we are okay. We can have symptoms, fever, sore throat, but RT-PCR is negative. You can have no symptoms, but for some reason you've done an RT-PCR and you're surprised that it is positive. And of course, a combination of the two, which is the worst, where you have symptoms and you are also COVID positive. And we'll deal with that as we go on. But remember this, that the good news is that 80% of the people who get infected will have mild or no symptoms. 40% remain completely free of symptoms. 40% have mild symptoms and they can be managed at home. 50% have breathing difficulty, which will require medical care. It is usually an ordinary ward with some oxygen, which will support you till you get better. Only 5 people will go into an ICU and only 1 person has a risk of dying. Now, why am I saying this? I'm saying this to reassure all those who are listening. Chances are, statistically, God on your side, that you will fall into the 80% category, not into the 15% category, just by sheer statistics. So don't worry if you're COVID positive. Don't worry if you're COVID positive and have mild symptoms. What you must do is to be vigilant about the progression of symptoms, and I'll tell you how to track that. The good news is that most will recover by themselves. I won't go into this except to know that more than missiles, it's soap and water that is saving mankind. All the nuclear warheads are on the shelf. It's soap and water and alcohol and Savlon that is now saving the human race. So you can use that as much as possible, but with discretion. Surgical spirits, Savlon, Dettol, aftershaves, whatever you have, can disinfect your hand and do the needful when you are conscious that you have been in a COVID environment. The treatment principles are this, that you quarantine yourself the moment you are exposed or you have mild symptoms. The first thing to do is to be honest to yourself and say that I'm going to lock myself into a room, tell your family. Okay? And you go for symptomatic relief. which is paracetamol, saline gargles, and rest. Paracetamol, saline gargles, and rest. Paracetamol, saline gargles, and rest. This is the mainstay of treatment in mild disorder, which affects 80% of the people. Report to the doctor for test. You need to test to confirm whether you have it or not. Report to the doctor if there is any sign or symptom of breathing difficulty. And of course, you arrest the leading edge, which means in your family, in your circle, find out who is the person who's on the outside edge and arrest that person, which means you don't allow him to move any further so that others are protected. It's a stressful situation, and all of us get worried, anxious, paranoid about what COVID can do, because there's no way you can predict. Uh, Chances are you'll be in that 80%, but you're always worried that you'll be in that 15%. So, how do we manage this stress? It's knowledge. And I'll tell you about 10 no's. And if you drill that into your mind, I think you will have peace of mind. One is, you know that this is a flu virus. The same fellow who gave you snuffles in 2018, 19, and even 2020. It has a potential to get serious, so that is where you will have to do your clever batting to keep the virus away. You must know that 80% of those infected will get better by themselves. You must know that prevention is better than cure, and this is the reason why people make mistake that they do not prevent and do not do the needful when it's the right time. Know that simple measures at home are more than enough. Know that measuring oxygen with an oximeter will alert trouble. That's your red flag, and you must have that. Today, an oximeter is more important than a cell phone. Take it from me, because that is a lifesaver. Know that you are more likely to recover than worsen. Know that you must relax and wait for time to cure. And more importantly, be still. That doesn't mean you don't do the needful, but be mentally calm, counsel yourself or get a counselor to help you, and know that God is in control of the situation and your life. Next question, are antibiotics effective in preventing COVID-19? Doxycycline, erythromycin? No. Whatever the WhatsApp university will tell you, the truth is that it is not effective. Are there any antivirals with definite effect? No. Remdesivir has been taken off the list by World Health Organization. Ivermectin, Fabiflu, there are no international guidelines, so it is best put under off-label use, which means some people have an experience with it, but it is not recommended universally. Steroids and immunomodulators is given in the pre-storm phase, that is, after your viral multiplication is over and before you become really sick. It must be identified by the oxygen levels dropping, and at that time, if you intervene with steroids, it is life-saving. Monoclonal antibodies, when the cytokine storm, the damage to the lungs are all taking place, that is where you need, of course, you need to be in the hospital. Who is a primary contact? A primary contact is a person in the same household. Even if he's staying upstairs, downstairs, in the distant room, if he is within your household, he is a primary contact. A primary contact is a person who has a direct contact with a COVID case and has had some exposure to the secretions without the necessary barriers. He's also a person who was in the close environment or had face-to-face contact with a COVID-19 case within a distance of 6 feet for more than 15 minutes. Now, this is applicable to a workplace situation where you have talked to your secretary and the secretary turns out to be COVID positive, or the other way around. Or you have dealt with a cash counter where the cashier has transacted something for more than 15 minutes and you later learned that he was COVID positive. Those are the situations. Okay, so these are the differentiators. I mentioned that. How do you differentiate between, there is this sense of loss of smell and taste that is specific to COVID, not the seasonal flu. Common colds last much shorter, 3 days, 4 days max, and then you move on. Whereas COVID lasts much longer, and the common cold does not cause breathing difficulty, never. But COVID does in 15% of people. Okay, I have symptoms, but my test is negative. What do I do? This is the golden rule that you have to assume that you are COVID positive. and manage yourself and others accordingly. Other modalities have to be in consultation with the physician. You can do an HRCT if you have symptoms, but your test is negative because you want to know whether your lungs are getting involved. You can do a NAT testing if RT-PCR is not available. Reverse, I am positive and my family is negative. Well, isolate yourself into a room and have everything delivered at your door. This is the only time you will be treated like a king. So order everything and it will be room service for you. Take special care of your elderly relatives by quarantining them, keeping them away. If there is another place that they can stay, please do that. But if they are not, then the best you can do is to quarantine them. Stay inside your home for a full 14 days till your tests are negative, and take all the medicines that your doctor has prescribed. Repeat your test on day 14. Even if it is positive, if it is positive, you can stay indoors for another 7 days and repeat it on day 21. You can see this on the screen, or this little gadget is a lifesaver. Everybody must invest rupees 2,000 to buy a good label one. This will be your red flag device that will tell you it's time to go to the doctor. Okay, buy a good brand, and the good brand is known by having a line which oscillates. A blue line or a red line which will oscillate, which will show you a wave pattern. Some brands do not have that. Do not buy that. Okay, so that's how you identify. And read the instruction, then test it on yourself, assuming that you are normal. Use fresh batteries and change it every week. Find the finger which is comfortable. It should not be too tight, not too loose. It can give you error. Do not move the hand once it's in. Keep it steady on the table so that for a full minute you will get a stable readout, and that is usually correct. Once in 7 days, you must take a tissue or a spectacle cloth and just wipe this red sensor so that all the soil has been removed. And your reading should be above 94. In young people, it is usually 96, 97, 99%. In elderly, it can even be 93, 92. It is acceptable. COVID positive, what do I do for my children and elders? Ideally, all the elders and children must be shifted elsewhere. Ideally, when it's not possible, quarantine them by keeping them away from your room. Usually, young children tolerate it much better as far as the second wave is concerned. There is a worry about the third wave. We won't talk about that now, but more children are being affected by the second wave. Some of them have been in the ICU. So we need to be very watchful. Keep a watch on your elderly by someone else in the family who is well, not yourself. And any breathing difficulty or discomfort must be attended to. There is a RAT test and there is a RAT PCR test, which is better. RT-PCR is the gold standard. RAT is a good screening tool because if it is positive, it's good. If it is negative, you could still be positive. That's the flaw in that test. And therefore, if you have a choice, just do an RT-PCR. We won't discuss this because we're running short of time. There is something called CT value. Just remember that the higher the CT value, the better you are. It just means that the viral load is less. It is reciprocal in relationship. The higher the CT value, the lower the viral load in your throat. So therefore, the better you are. However, it does not correlate with clinical symptoms. It just talks about the number of viruses in your body. It doesn't necessarily correlate with the severity of the disease if you have it. Common situation, no hospital beds, what do I do? As I mentioned before, most people can be managed at home. While you decide to be at home, try and access home oxygen therapies like an oxygen source, either in the form of a concentrator or a cylinder. As you stay at home, let your loved ones continue to try and access a hospital bed through whichever portal that is open. Groaning and oximeter are important tools. We'll talk about that, and take all your medicines. The rest of it is all support exercises like nutrition and hydration, etc. When you feel breathless, before you get to the doctor, can be a bridge therapy where you put yourself belly down with 3 pillows, one at your neck, one below your tummy, and one below your ankles. And that will release more of your lungs to take part in the act of breathing and you will feel better. You will see that the oxygen level. This is not treatment. This is just a bridge maneuver that you do before you get to the hospital. We won't do this because it may not be relevant, but we will move on to, if you have fever, what should you do? In the context of the COVID epidemic, you must get yourself treated immediately. Child or old person, get yourself checked out, and that will sort out many things for you. If you have mild disease, home is better. If you have moderate disease, home/hospital, you have to take a call with the help of your doctor. And if you have severe disease, there is no other place but to be in a hospital. That is the simplified format that I can suggest. Coming to vaccination, we have only two vaccines available, Covaxin and Covishield. Covishield has been used in more than 90% of the Indian population because it had a head start, came early. Covaxin has just been approved. The numbers will pick up. The data is stronger for Covishield. If you have a choice, if I have a choice, I'll go for Covishield. But Covaxin is just as good in terms of its claimed efficacy. Soon we will have the Russian Sputnik vaccine, the Zydus Cadila vaccine, and many other vaccines that are in the pipeline. Can a vaccinated person get COVID? Yes. This is a myth that has to be broken. Vaccination does not prevent someone from getting infected. Your nose could still receive the virus and allow it to colonize. What it does is to convert what could be a serious disease into a mild disease, so you are protected. But you could be a transmitter, you could be a carrier and give it to different people, highlighting the importance of masking even after your vaccination schedule is complete. Can a COVID-19 infected person be vaccinated? Yes, there are protocols for this, and your doctor will advise you on that. I have recovered from COVID, why should I take the vaccine? Good question. You can take because in a lot of people, the infection does not induce the needed immune response, and therefore after checking an antibody titer level, you can choose to have a vaccination done at the appropriate time. Gap between vaccinations, if it's Covishield, now it is 8 to 12 weeks. For Covaxin, it is still 4 weeks. All elderly people must be vaccinated, whatever their problems are. And women who are in their menstrual cycle can take the vaccination. There is no contraindication to take any vaccine for that indication. The side effects of vaccines are very simple ones. The very most common ones are some soreness over the site of injections, little fever, some joint pains, will go off in 24 to 48 hours. Very rarely people have had allergic reactions and enlarged lymph nodes, sweating, etc., which does not negate the value of vaccination. For those who are interested, I will WhatsApp this to you. This is the CMC Vellore algorithm for mild, moderate, severe. It is very simple, and you can follow this, keep it on your desk or hang it on your wall, and this will guide you to the right kind of treatment. It is not possible to describe this in detail. We are all hearing about the black fungus and the white fungus. What is it? Black fungus is a good neighbor that you have in your shoes and on top of your cabinets, and in certain types of food. It is also present in the normal mucosa of the mouth. It is a friendly neighbor, doesn't usually attack you, but when you are immunocompromised, it could take the upper hand. And that is what is happening because of steroid overuse in the setting of the COVID management by private practitioners, etc. It is an indication of how immunocompromised people have become because of the treatment, not the disease. And there's also this very rare white fungus, which is another kind of fungus, which is also getting more ground in this immunocompromised status. This term is worrying us. The third wave, what is the third wave? Again, it is self-explanatory. We had the second wave, the first wave. The second wave was much more acute. It was much taller. Many more people have died. There is nobody in this group and in any group where someone close to you has not suffered because of this. The third wave is an anticipated wave. If we don't follow, this is where we are, the star shows where we are. Hopefully, we will come down. There's a worry about a third wave which may come as we relax our lockdowns and as we become complacent again, saying all is well, and we get back to our crowded environments. There is a possibility of a third wave against which I'm sure the scientists and the government is this time working with greater vigilance. Children, young adults, rural citizens, and elderly are expected to be more vulnerable, especially children. So we got to guard them. One good thing that you must do is insist that all your caregivers to your children are immunized, because children are not yet ready to be immunized as per the regulations are concerned. So the best that you can do is all adults, immunize the entire external environment for them, and they will stay protected. I think I will end here over short time by 5 minutes. Remember that at the end of the day, this is what is important. Whatever we do, the COVID virus doesn't differentiate from the rich and the famous to the poor, to the powerful, to the powerless, to the medical person, to the non-medical person. It doesn't differentiate. But this is heartening. Psalm 121 verse 7, the Lord will keep you from all harm. He will watch over your life. It also means that we do the needful in terms of understanding the illness, not panicking, and doing the right things that the medical fraternity, the doctors and the nurses tell you to do. With that, it's time to say good night, COVID.
Thank you, Dr. Sunil. Do you think we have time for a few questions?
Yeah.
Can I read them out to you? Okay, we have a question. I know we went over it briefly, but we have a question which says, in the last 3 months, we've seen adults between 30 to 50 are succumbing to COVID. Is there a reason for that?
Yeah, so the theory is that, the virus keeps on finding fertile soil. So in the first wave, it attacked people predominantly who were above the age of 60. Most of the mortality was in that age group, at least in the overseas countries. Even in India, it was more on that. Now, there is a herd immunity that has built up in that age group. So the next fertile frontier for the virus is the next group, that is the young adults. One reason. The second reason, these are all theories, okay? So let me tell you what I have been told. The second reason is the 18 to 45 group is the productive group of any country. They are the people who are more mobile, more enterprising, more adventurous, therefore more complacent. Okay, will have a chalta hai attitude. They're also people who are on the move. They go to the office, they go to the restaurant, they party, they huddle. And that pattern has gone on in that window between the first and the second wave, because there was a false impression that we have conquered, we have overcome COVID in a very special way, which was not true. So the virus waited, crouched to attack, and it had attacked those people which were easily available to them on the outside territory. So these are the two reasons. Despite their stronger, robust body constitutions, they were attacked. And now the third wave theory is the same. Now that they have been attacked and there is a herd immunity amongst them, the next fertile soil is going to be children who have not been vaccinated, who are exposed to the same kind of lifestyle. They play, they go out, they mix. It's difficult to regulate them in terms of mask, social distance, and therefore the third wave is likely to be a little ominous for them.
Here we have another one. I have been vaccinated with Pfizer in another country. If we are advised to take a booster dose after 1 year, will any vaccine do, or do I have to take Pfizer only? Or is it still too early to discuss?
Yes, there is a consistency of vaccination that is expected. Whichever brand is your first vaccine must be the same for your second vaccine as well. This is by convention. So if you've taken Pfizer, Ideally, you should have taken it in the stipulated time interval, but since you have not done that, I think you will have to just observe universal precautions and go back to your country. Or if Pfizer becomes available here, or you can take it privately, if there is some mechanism by which you can access a Pfizer vaccine, you can do that as well.
We know that good ventilation is essential, but if our windows open out close to a street, is it safe?
Yes, it is much safer than being in a fully air conditioned glass cage houses that we all live in nowadays. It is because the wind will carry it, and in carrying it, it will also dilute it. Okay, in comparison to the totally contained environment that your house may provide in a fully air conditioned environment. So you can open your windows, okay, to the street, and be assured that the virus inside will only exit. It's unlikely that viruses will come in. Even if they come, it will be in small numbers, I believe.
If you use an N95, do you still need to double mask? And if you reuse the mask, could there be a problem?
No, actually, one of the reasons mentioned in a newspaper was that black fungus is because people are reusing their masks more than the required number of times. So a soiled mask is causing these fungal spores to get in. Theory. N95 is a little more durable. It is designed to prevent particulate pollution to get into. So it's used in places like Delhi where you are fighting pollution. But it also has the same barrier effect against the virus. So you need not do a double masking if you're using N95 alone. But change your N95 once in 2 days.
I've taken both doses of Covishield. The second one was 48 days after the first dose. Now it says the second dose should be taken 120 days or longer after the first dose. Is there any challenge that I
No.
could complete it?
Initially, the second dose was recommended 4 weeks. It became 8 weeks. Now it's 12 weeks based on an international study published in Lancet, one of the most reputed scientific journals in medicine. And that 12-week window gives you almost 90% protection. So if you've taken it at 48 days, it doesn't matter because that's the booster for you, and your immune system would have kicked up your antibodies to a level. If you want to double check, just ask for an antibody level and see whether it is up or down. If it's down for some reason, unlikely, but if it is down, then you could make a case for a third booster, although that is not part of the regular recommendation.
Is fibrosis of the lungs reversible?
No, it is not. Fibrosis is seen in many medical diseases. Fibrosis basically is the medical term for scarring. So once you have a scar on your face, it will never go. Like that, fibrosis is a process of scarring of any tissue which causes shrinkage. The elasticity of that, the compliance or the resilience of that organ gets diminished. And if it happens in the lung, it means that you will have a much higher work of breathing. To breathe properly, you will have to exert more and you may feel breathless.
The HRCT scan for my husband says 15/40 severity score. Is it curable?
No. This is no. The scoring system just tells you the amount of damage of the lung because of the inflammation that's going on presently. So if the person recovers, those changes will also reverse. They will revert. It has got no long-term implications. So it may be 15/40 or 25/40, but if you recover, if the person recovers, the repeat CT scores will be much less.
How advisable is it to conduct examinations with all COVID safety protocols, as many universities and schools are planning for this?
Not advisable. Well, we've heard so many discussions on if all the children are vaccinated and all the examiners are vaccinated, all the invigilators are vaccinated, yes, it may be possible. But that not being the case, getting people into a hall, 200, 300 people all sitting at unacceptable distance is definitely a risk, even if the mask and social distancing norms are followed.
How safe is it to have a help who has had only one shot of the vaccine in a house of over 70s? The elderly have had both their vaccines.
You're talking about a domestic aid?
Yes.
Yeah, so one vaccination is better than no vaccination. It is very unsafe to have a domestic who's not vaccinated at all, because every day that person will be going back to their own colonies, getting exposed to an unknown number of people and coming back with that. So even if she's okay today, you may do an RT-PCR and she's negative. That may not actually confer protection a week from now, because she could get infected after the test. So the best thing to do is to insist on vaccination. If the person refuses to be vaccinated, there's a tough call to be taken whether you want to retain that person in your home, because it could infect the whole household, especially if there are children and elderly people.
We'll just take a couple more.
Yeah, sure, go ahead. It's your time. I'm okay. Whenever you want to close, you can close.
Okay. I'm a recovered COVID patient, but now I'm facing severe heel and foot pain. Is it interrelated?
Not specifically heel and foot pain. I've not heard that. But muscle pain, myalgia, which is called myalgia, almost like the chikungunya variety. Intense fatigue, which lasts for a couple of weeks, is quite a common symptom that people are complaining of, especially in people who are above the age of 50. Even in younger people, there is a tiredness or a fatigue or easy fatigability. Doing small chores in the house induces that fatigue. You just want to lie down. So that is because of the effect of the viral infection on your body, your proteins, your muscle proteins, etc. And it takes time to recover. There's no specific treatment except to get back to your nutrition, plenty of fluids, plenty of proteins, fruits, vegetables, maybe a couple of B-complex which will replace those trace elements that you may have lost, and give it time. Don't panic. The only thing that should take you back to hospital is breathing difficulty again.
We have a similar question to one we had before. Having taken 2 Covishields, is it advisable next year as well to take only Covishield?
Yes. If you've taken Covishield, you're committed to Covishield for life.
Can a family, 2 or more people, get vaccinated on the same day?
Oh yes, why not? Can.
My sister is COVID positive for the past 22 days and she still has temperature, especially when she exerts herself.
If it's 22 days, it's unusual. I would recommend that this person goes to the hospital, because if it is really 22 days, there is something that is missing. Something needs to be, it may be another infection that is at the bottom of it. It needs to be identified and treated. It is unusual to have fever for 22 days. So there is something that has not been identified, and you must get to the hospital and sort it out.
We'll just do one last one. Can we take vitamin C tablets even if we do not have COVID?
Yes, you can. You can. Vitamin C is a necessary ingredient in the cascade of building up immunity. It's a raw material which is required to build up the immunity. Now, let me clarify this. Taking vitamin C during a COVID infection, saying that it is building up immunity, is not entirely true. Vitamin C is an ingredient which is in steady supply, because you're also taking citrus fruits and various other things which will supply that. It is also not a bad practice to keep taking vitamin C throughout your COVID infection, but don't believe that vitamin C is going to boost your immunity acutely because you're taking extra. That's not going to happen. So please take vitamin C. If you can't buy vitamin C, just take some lime juice and the usual things that give you that from natural sources like citrus fruits. That's more than enough.
Right. After taking the first dose, if someone gets infected, how long should they wait for the second dose?
If you have taken the first dose and you are infected or you are diseased, you must clarify that. If you are just infected, it means that you're just colonized and you become positive, but you have no symptoms whatsoever, then you can carry on with your schedule and take it, if it's Covishield, after 12 weeks. I'm sure within that 12-week period that will become negative. But you're also symptomatic, you have a COVID illness, then you will have to wait for that illness to get over. Ideally, you must go to a laboratory and check your antibody levels and consult a doctor who will advise you what is the ideal time window for you to take the next injection.
Great. All right. I think that's the questions we've had. Sorry, one more just popped up.
Yeah, no problem.
My mother-in-law tested negative after a COVID recovery. Her saturation is not going above 94. She is aged 56.
94, I think, is good enough. If it's 94 consistently, she's how old? 56.
Yes.
I don't think there's anything to worry about 94. I don't know whether she's a shallow breather or whether if she's feeling breathless with 94, yes, she needs to attend to that. But if it's COVID negative, I would recommend some deep breathing exercises, because most people with age, they underbreathe. You don't have the full lung tissue being recruited. So you have to make an effort to breathe. Take some deep breaths occasionally, or do a 10-second breathing exercise, and that should solve the problem. There is something called a 6-minute walking test which can be done, which I did not describe. If you walk for 6 minutes with your oximeter on, if you find that the oxygen levels are dropping, there is a problem. You must get to the doctor. Okay? But this is not an easy test to do because it can panic you. It should be done the proper way. Ideally, it's done under medical supervision. But that's one way to sort it out. But I wouldn't worry too much about 94. I would worry about 92. But 94 is okay. I hope the oximetry is being done properly as well.
We just have someone asking for your opinion on this. Dear doctor, some of the medical practitioners have taken Covishield, both the doses, and again, now they are taking Covaxin with a different identity, Sources Times of India. Is it advisable?
Well, I'm sad to hear this, that they are doing this. It doesn't make that. There are different platforms. Covishield is a different platform. Covaxin is a different platform. So it is not recommended. I'm sorry to hear that medical practitioners are doing it. For what reason, I do not know. But I would not recommend that, and I think this is not the right thing to do.
Okay, thank you. Thank you so much, Sunil.
Are there any? If there are any questions that are not answered, you could WhatsApp them to me, and I'm happy to address them on a written format. But thank you everyone for patient listening. I hope it made sense.
Thank you, Dr. Sunil. Sunil there is a huge confusion about who Dr. Sunil is. Yeah, Karun called him uncle. Sunil is my sister's husband. Also happens to be a Chandy. So there is a confusion as to how George is my brother. Hopefully one of these Wednesdays we'll hear him also. But Sunil, thank you so very much for being with us and blessing us with this amazing exposition of this whole thing. It's been, as you said, a new word that has got into our dictionary, and it is going to be BC and AC from now on, I suppose. Yes. Also want to thank all of you who were with us the last 1 month almost, as we struggled through different situations, different terrains which were so unfamiliar. And thank you for really and truly being with us and encouraging us as we struggled through it all was going through the answers that Sunil was giving us, and it's so very true, all that he said. We went through struggle. He had been telling us again and again in situations, listen, this can suddenly drop, it can suddenly change, so you need to be careful. And really are thankful to all of you for keeping us cocooned in your prayers, because we found ourselves really floundering. And thank you so very much for being with us and guiding us. For those of you who want to hear more about this and would like to get the details that Sunil was telling you about, we will be keeping this open for a bit with some music. And if you put in your names and numbers, we will see that you are also added to the group, and in the process you will know as to when we'll be meeting next and things like that. Any other things that you would like to know also, you could send us a WhatsApp message or something like that. Thank you very much. It's been a good evening. May God be with you. May God protect us. May God cocoon us in His care and His guidance. There is no other way. It's Him or nothing. One of the songs that I have sung maximum in my life is Hide Me Now Under Your Wings. And that's all that there is, as Sunil was saying. Yeah, run and hide. Run and hide under His wings. That's about it. I'd like to request Reverend Vincent Rajkumar to say a word of prayer and close today's webinar.
Let us pray. Our gracious, loving Heavenly Father, we thank you for this time of our togetherness to understand the present problems that we are facing in our world. We thank and praise you, Lord, that you are a co-journer with us, a person who is traveling with us in our pain, in our agony. That is the source of strength that we have in facing these difficult times. We thank and praise you for the healing touch that you have given to many and sustained and strengthened many people in their difficulties. We also pray at this time those who are not able to make it, and we believe and trust that they are in your presence, O Lord. At the same time, we pray for those who are grieving at this point of time. Console them and give them peace from above, and make them to know that they are in your protection and care always. We thank you for the enlightening way that Dr. Sunil has given us an explanation at this point of time. We thank you, Lord, for making us to be strengthened by his presentation this evening. May we be aware of the difficulties that we go through and be cautious, at the same time mindful of our neighbors and their health. We thank you, Lord, for the way that you have spoken to us, and let this be a guidance for us in order that you will be taking care of us in a beautiful manner. Once again, we commit each and every one of us into thy throne of grace. Continue to bless us and protect us, O Lord, and make us your channels of your witness in this world. We pray for all those who are in the healing ministry, the paramedical workers, the ambulance drivers, and the people who are running for safeguarding the lives of the people. We commit them into thy throne of grace. Give them, O Lord, your strength and good health, and make them as your channels and your mediators of healing that they're going to give to the people. Thank you for this evening, and let this evening be a blissful and meaningful experience for each and every one of us. In Jesus' matchless name, we offer our prayers. Amen.
Thank you very much. A very good night to you, all of you.